Hi, it's Angie Settle with West Virginia Health Right, with your health done right. I'm here today. We've had him on here one other time. It's Dr. Dan Thistleway. He is a board member, but he's also a practicing psychiatrist here in Charleston, West Virginia, for many, many, many years. And he oversees the behavioral health and recovery facility and all the programs that we do at West Virginia Health Right. So welcome, Dr. Dan.
Thank you for having me.
All your
Much
buddies call you
appreciated.
Dr. Dan.
My privilege.
Thank you so much for coming on. You actually were in the clinic today seeing patients, so we got to talk a little bit about the facility,
Right.
which is pretty unique, and especially with the free and charitable clinic, to have a facility which last month we had the board president on, and we were just talking about the facility in general, but I wanted to bring you on because we've been blessed to now have a dedicated behavioral health and recovery wing.
Yes.
So basically 50% of the clinic, probably more like 33 because it's not the second floor, but is dedicated to just behavioral health and recovery services. And just to bring you on, we'll talk a little bit about why that's so important, a lot of the things we've seen post-COVID and all of that. So
Sure.
welcome.
Thank you. Yeah, it's been amazing to watch, what you and the rest of the team accomplished over there in that just magnificent expansion. And we have a space that's absolutely gorgeous on the behavioral health side now that we're very, very proud of. And I think it really, puts our patients at ease, and they really appreciate that. There's been a real emphasis and an effort to really put forth a really nice facility. And not to mention all the wonderful people we have on the behavioral health staff now that we can afford, to provide them the kind of care that they really deserve and need. And as you know, I've talked many times, Health Right has a particular role, and that being kind of the niche between the dedicated people in our community who already are providing mental health services, but are often overwhelmed.
Right.
The need is so great that a lot of times they just can't keep up with the demand. And that's where I see us really fitting in, is to try and provide that sort of support and stopgap intervention until we can perhaps get them with the right folks that maybe take over and carry them over the long term. But people, when they need immediate care, sometimes it's just not available because of the need.
So just kind of recap, I know we brought you, I think it was, I want to say 2015-ish, when you came on board to really help us, because we wanted, at the time we didn't have any behavioral health services.
Right.
Everybody that came through, if it wasn't just kind of the basic run-of-the-mill things that the family nurse practitioners were used to, or the family practice docs, everything was referred out. So what we found was, in the community, and you can attest to this, we would have people that have, really serious cases and issues, maybe bottleneck behind people who had a mild case. So then you'd have people waiting 3 to 6 months to even get in for care.
Right.
So what this has allowed us to do since then is to actually intervene, triage, help the people that we can help there, and bring you in. Of course, sir, you're here 1 full day a week to see patients, those patients that need your higher level acuity care, but then also those that you think even more intensive care, for us to refer those people out and get them out rapidly, not waiting, months and all that. And then the great thing is partnerships in the community. We're not an island, is to know we have people at the different facilities that we work with and refer to, whether it be recovery, behavioral health, or inpatient, where we can call, where we have friends, and we can all work together. So whether it be they discharge somebody and they can come to us for outpatient, or we need somebody intensive, we can get them in. So that's been a huge, huge help. And I think too, and I think you'll agree, leading up, 10 years goes by fast, but it's been almost 10 years we've been doing this, but COVID, the whole impact of COVID and the pandemic, and how that impacted everybody. I'm sure you've seen that in your private practice, sir.
Yeah.
I feel like this is timely, is what I'm trying to say, in terms of having this facility.
Yeah, I agree. And one of the things that, we see statistically, and this is repeated from the American Psychiatric Association, that, the COVID pandemic drove up. And if we just look at depressive illness, not to mention the other mental health problems that people face, but when you just look at depressive illness, there was a threefold increase during the COVID pandemic. And one group that was particularly hit hard were our younger folks. You know, it disrupted their lives in such a fashion, and the amount of stress, partly from the unknown, you know, what was COVID going to do, how was it going to turn out, who were we going to lose, to the just disruption of our communities because of necessity, and again, because of the unknown. We didn't know exactly how to manage or handle that. So we've seen just a huge increase, and unfortunately, you know, in our younger population, particularly an increase in suicide rates, which is very, you know, distressing to all of us in the mental health field. So there's just a lot of work to do at this point. Not to mention that if you look at, you know, other issues that are particularly, I think, unfortunately, a real problem in our Appalachian, you know, communities, that being substance use problems. You know, we're ground zero, really. And if you think about it, you know, the number of people that lose their lives to overdoses. You know, fentanyl, I know when I was growing up, there was no such thing. You know, and if there was peer pressure to, quote, try something, probably wasn't going to hurt you. Well, now, if you take a 2 milligram dose of fentanyl, you die, you know. So I know I was watching a program on television, a poor woman who was recounting losing her child who had never done drugs before and tried one thing, and that was it.
Yeah, it's horrific because, you know, back in the day, which, you know, you'd think, you know, when I was in high school, you'd think about parties and stuff, and people, you know, the worst thing you'd hear about, you know, people would be drinking. I get it, and now we're showing our age now, Dr. Dan. Now it's like you see something and, you know, peer pressure, and you get a 15-year-old or whatever, takes one pill and they don't know what's in it, and it's laced with fentanyl, and that's it. And then there's even worse things than that now out there with, like, animal tranquilizers and everything. We've seen people come through. I had a couple come through that were coming off a horrific addiction to that, and it was very scary for the staff and I even, but we were able to get them help immediately. But there's just so much more exotic things out there than we ever dreamed possible, say 15, 20 years ago. So it takes so much effort now, and just a, you know, all hands on deck thing. But I'm proud of that, especially with your help, sir. We could have never have done it without you, to actually have that now. And it's important to say, you know, it's behavioral health and a recovery wing. Of course, we're dealing with people with substance use disorder, and we're meeting them wherever they are in their journey. But our overarching goal is always going to be to try to help people, you know, get into recovery. And help get them, their lives back in order and all that. So we're blessed to have a lot of mechanisms to do that. We don't try to replicate services. We have a lot of, and chime in wherever you want, you know, referrals for Suboxone therapy, and we do Vivitrol on staff. You know, we support, you know, 12-step. I always tell people whatever works for that person, and we're all in, and, you know, but we have safeguards in place to make sure, you know, that people are on the right road, and, you know, there's no diversion and all that kind of stuff. But it's definitely grown to be a bigger percentage of what we do at Health Right, because it's so hard to divide out, you know, substance use disorder, behavioral health, physical health. It all goes together. I'm sure you know that more than anybody.
Absolutely, and I think because of the population that we mostly serve, and I think, as you've been fond of saying, you know, the majority of folks who come to Health Right are actually they're working people, you know, but they can't afford, you know, to go sometimes and get the kind of care they need. They can't afford insurance or what have you. But I see them as a very vulnerable population. Also, you know, we have folks that are, you know, challenged with no housing availability, or sometimes have just come in from some other area. And these folks frequently, if not always, have a combination of problems of chronic mental illness, substance use problems, not to mention serious physical health problems as a result of all these things combined together. And so you're trying to tease it apart. And the one thing I truly feel so good about at HealthRight is the collaborative nature of how we work together. You know, if I have a concern about a medical problem, it's literally 2 seconds, and I've got a nurse practitioner who understands the medical side of things that can, you know, intervene and help us out right there.
Right.
We've got, you know, dedicated, counselors and coaches for addiction and recovery. So if I see somebody who comes in who's got a different kind of mental health problem, but I also recognize it's being complicated by a substance use disorder, now I can get them on board and help, you know, get them to get involved. And as you mentioned, you know, we're not trying to become a behavioral health center ourselves. That's more than we can do. But we really have a good partnership, I think, with the other stakeholders in our community mental health center, some of the local hospitals. I'm clinical faculty for West Virginia Department of Behavioral Medicine. So we can reach out to any of those folks when we see that the need for this patient is way greater than we can provide, and or it's going to be more of a chronic problem that needs more support and ongoing care than we can possibly give them. But if we can intervene, as you said, meet that patient where they are, help them right at that very moment, we've got a much better chance of convincing them to actually get involved in something that will help improve their quality of life, their overall health and functionality, versus if you let them go and it's another 6 months down the road, 8 months down the road, the chances of actually helping them out are significantly less. So,
absolutely. And I think people need to understand, and I said this repeatedly, is if you try to treat like substance use disorder without treating an underlying behavioral health issue, you are going to fail miserably.
Yes.
Somebody has like bipolar or whatever, or they're trying, that just doesn't happen. And that's why, you know, we do see people with behavioral health problems that don't have substance use disorder problems. That I understand there's probably some people with substance use disorder problems that do not, but I would guess estimate that the large majority do. They kind of overlap, and that's why a lot of times those kind of go together. We see that as something that you can't really treat one without the other. They have to be treated together, because you know a lot of times people are self-medicating. You know how it goes, the story, and I've tried to explain to people, you're just. And even trying to get, you know, with the stigma of substance use disorder and everything, a lot of people don't understand the whole background of sometimes people are self-medicating. So it's like untangling spaghetti that you're really good at. And that's why you're so essential to what we do. Also, I want to give you kudos to the fact that the part that you're talking about with your partnership, and you know this person, you know that person, you're so key in our program because you know all the right people to get our patients in where they need to be treated. And that's so important to have somebody advocate on this level to get people where they are, because a lot of times, like you said, they're working, they're lower income, they don't know, you know, they don't know how to navigate the system. If you tell somebody, one of our clients, well, we need you to go down here and fill out this paperwork and then go over here, I mean, you've already lost them. So I think that's what's unique to have everything under one roof. You know, we have you there, we have the pharmacy, we have everything there, and then we have a DHHR worker that Vandalia Health, Charles Area Medical Center, supplies to us to actually put people through the rigors to see what they qualify for in terms of benefits. And the whole point of that is a lot of times if you say you need to go down to this facility and sign up for benefits and and you need to take the bus, well, that's it. I've had people come back to me and say that, you know, that's, and two, when somebody is even in a deep depressive state or whatever, that sounds so overwhelming.
Yes.
To you or me, that sounds like no big deal, but to them, that's so overwhelming. So anything that you can do to be patient-centered really does help.
I agree completely, and I think you make such a good point about, you know, the need for, you know, urgency to get those things that we sometimes overlook, because, you know, when people come in and we say, well, gee, we think this medication might help you with this disorder that you're struggling with, and they have no way of understanding how they would even access that medication. So we're so very, you know, lucky to have a dedicated pharmacy right there. So if for some reason, you know, they don't have prescriptive coverage, Medicaid benefits, what have you, we can literally walk down the hall and get these medications most of the time for them at no cost, so we can get them started on something, get them going. The other point I would make, and this is sort of the other side of our clinic, which is focused on other medical problems.
Right.
Again, this is a population that frequently suffers with lots of chronic illnesses, hypertension, diabetes, cardiovascular disease. And the one thing I would also say, yes, we're not going to get these other disorders, settled if we don't get the mental health problem
True.
right. Good luck managing somebody's diabetes if they're suffering with terrible depression. They can't manage to motivate themselves to do the things that they know they need to do.
Absolutely.
But depression gets in the way, and it's not volitional. It's not a choice they make. It is because they simply can't do it. So if we intervene on both sides, we're much more likely to help them get, stability in all of their health. So I really see it as again, sort of a wraparound collaborative effort, which, every study ever looked at says that's the best way to provide medical care, is having, multiple different specialties that are available and multiple, other, needs. Again, having a DHHR specialist right there. All of those things make a big difference to the patient when it comes to actually having a successful outcome.
Yeah, absolutely. And two, and there's great facilities no matter, where you are in West Virginia. We encourage you to look for those, but you can always call West Virginia Health, right? Because even if we're not the answer for you, we like to say that we're a green light, not a stoplight. So you can always call our main office at 304-414-5930. That's the main number, because a lot of times we've done this so many years that we, know a lot of the different places and tricks of the trade and whatever, and we would always welcome to help anybody that needs it to come to Health Right as well. It's very unique. One thing I think that's different that a lot of people, and I've talked about this before, but I haven't said it again, a lot of people don't really understand a free and charitable clinic, or they get a certain idea. I've had this told to me so many times because I tend to take people on tours, potential funders, etc. And they're like, wow, this isn't anything like I thought this would be, because a lot of times when you say free and charitable clinic, a lot of people get this picture of, dark and dingy and dusty and cobwebs and kind of the old hospital ward looking kind of, environment. Right. And something that I've always been really adamant about since I took over as CEO is just the aesthetics of it. Not just for appearances, but the whole heart behind it. Yeah. So a lot of times, even for the staff and for the patients, I feel like, what you project and the appearance and the whole overall patient experience is so important.
Absolutely.
That they can feel, kind of that real empathy and love behind it. Because a lot of the people on staff like myself are so passionate about it. It's really hard for me not to sit there and say, okay, when I'm looking in a room or when we're designing anything, okay, if this was me or my grandma or my sister, what would I want? What would I want in this room? What would I want this to look like? Right. And I think we've put a lot of heart behind everything that we do. There, the board, you're on our board. He's on our board too. He just never leaves Health Right. He's here all the time. Volunteer member of our board, that we really try to put a lot of that behind it. And I think it's been a huge success. I got to give you all the credit in the world for thinking about that. And I couldn't agree more. When you go into a place that's bright and airy and people have energy and empathy, and they've got a smile on their face when they greet you, it's a whole lot easier to deal with, feeling awful from a disorder that you're dealing with, no matter what that might be, when the people there care and you see this really wonderful, beautiful place that's been constructed to help you, Yeah. So, I think it has a huge positive impact. And again, I'm so very thankful. We've had a wonderful renovation to our behavioral health side. It was always nice anyway, but wow, it's really special now. I think we have some pictures that they'll show you, but just dedicated office space. The whole wing is specific just to that. There's a private entrance, a smaller waiting room. We can expedite care. It's all one clinic, but it's also a separate wing. So, people, it's a little calmer and a little quieter over there. There's a small group area that we never had before, different offices for you and the behavioral health nurse practitioner, recovery coach. We have licensed professional counselors and therapists and social workers all in different areas. So before, we were in a facility meant for about 15,000 patients, and at that it was tight. And actually the original building was built in 1999. So now with 40-some thousand patients and like almost 2.5 times the staff, it was so hard to just have any, you remember, to have any privacy, quiet, protect HIPAA and all that kind of stuff. Not for lack of desire to do it, but they're just people on top of people everywhere. Just to even find a quiet corner to talk to somebody was very hard.
Yeah.
And I just went through there yesterday, just kind of, every once in a while I think I'm just going to walk through the clinic and take a little look, and it kind of, oh, that's good. This is nice. So I went through and I just realized how quiet and so much more conducive to helping people that it was.
I agree. And, this morning we saw quite a number of folks, that came in, and it was so much easier for all of the staff to just logistically get people in their places, get them prepared, make sure that I had the information I needed to work with them for that day. And so it's running like a very well-oiled machine.
You've been a trooper, because I know you've got through there some days in the original building, and it was so chaotic, and you're just like, whoa. But I do like that part of it, and I think but again, it's one continual flow. For anybody that's been to Health Right, if you come in the building now, the old main entrance is now the Behavioral Health Recovery Center entrance, and then the new facility is where you go in for primary care. But again, it all connects. We're all still there working together. We just have a little space now. We're not sharing a space with like 4 or 5 different people. But I want to take the opportunity to just, you know how much I respect you, sir. You've been in practice in Charleston for many, many, many years. Very well respected. You've treat a variety of conditions and disorders and everything like that. What would you say right now? We have an audience here. There's a lot of people out here that are probably struggling with behavioral health disorders, and I hope that we're making strides as a society and here in West Virginia for people to understand it's okay. Yeah. It's okay to go get help. It's okay to go see a psychiatrist, okay? Just like people don't pick their eye color. They don't pick the fact that they get thyroid cancer. A lot of people, there's things you can do to help with your blood pressure, but still genetics and heart disease. You don't pick these things. No. These are not things that you pick or would desire on anybody. Right. The same thing goes for behavioral health disorders. There used to be this old thinking. I remember when I first in practice, and you'd hear people, I need to do, and then, there's things, great, go out, it's sunny, take a walk, do what you can do. But some of this is genetic. Yeah. And if you look at family histories, you can go back and see, daughter, mother, grandmother, great-grandmother, bam, bam, bam. So a lot of it is, I hope people understand that there's such a genetic component, and that there's more understanding, that people feel free to go get help. Admit that you have an issue. It doesn't make you weaker. It doesn't make you any less than anybody else. If I could say that 15 times over, I would. If there's anybody out there suffering from any kind of behavioral health disorder, please get help. It does not mean you're weak. It does not mean that you're not tough. It does not mean you're not trying. There are physical, biological, chemical things in your brain that you cannot alter that you probably need help with, and I would encourage you to do that. Yeah. I'm kicking it off to you.
No.
I just preached my sermon.
You're right on target. And, just remind me, as you were talking about, a shirt we had a year or two ago for Mental Health Awareness Month that said, it's okay to not be okay, And the bottom line is, as you said, mental health disorders don't care who you are, where you're born, how much money you have, et cetera, et cetera. I think our working theories about most mental health disorders are that there's a genetic vulnerability that we have no control over. Genes are what they are. You get what you get. And then frequently there are different stressors that may trigger these things. We don't completely understand that yet. But clearly, as we were just speaking, COVID, threefold increase in depressive illness. Well, how did that work? Well, that wasn't just genetics, but an external stress that created something to be worse. I have people all the time that come and say, my life is perfectly fine, why do I feel like this? And the answer is because you have an illness that's causing your brain not to function properly. Absolutely. This isn't because you choose to feel badly. Nobody chooses to feel badly. It just happens. Substance use disorders, we know that there's a high genetic preponderance for that as well. So, there's a lot of things that go into this, and the brain is the most complex organ in the human body.
Absolutely.
We still haven't unlocked all of it by any means. We're much better. We're certainly better than when I first went to medical school and started out, and I've learned a whole lot of things along the way over the 30 plus years. Gosh, boy, do I feel old now. But, I think the good news is we are coming up with better and better treatments, better understanding. And I think you're correct. Many, many people now understand that it's perfectly okay to come in and say, I'm having this problem. Can you help me with it? You don't have to feel guilty, weak, et cetera, et cetera.
Absolutely. And you mentioned, like, it's not so simple like an orthopedist. Okay, yep, that leg's broken. You take a picture. It's a lot more complicated when you're talking about the brain and environmental factors. And what I've seen too is during COVID maybe people kind of had a propensity to certain things, but they kind of always held it in check, and that just kind of pushed them over the edge. Again, it is complicated because it can be genetic, but then you have different environmental things. But it kind of seemed to be what propelled people who always kind of held it in place to finally just kind of, say, okay, this is too much. And I'm sure that it's been a bigger stress even in private practice and trying to get everybody in need. And that's a huge part in West Virginia as well. We have geographic challenges. We have provider shortages. So even when you look across the United States, people talk about, not enough behavioral health treatment and not enough, recovery services. So when you put all that into West Virginia and then you put on top of that people being lower income or non-insurance, it seems very overwhelming and challenging.
Absolutely.
So we just wanted to talk about today some of the resources that you can get through West Virginia Health, right? And then we hopefully can connect you. But we got a few more minutes here. Anything new, upcoming, just cutting edge, anything that you can think of? I know you're always looking at different things that you've learned about or excited about in your field of practice, sir.
Well, I think there's a couple of things. Treatment resources now for different disorders, I think, have expanded dramatically. One example I like to talk about is a thing we do at our private practice called transcranial magnetic stimulation. It's basically using a magnet like you'd find in an MRI machine to stimulate the brain for different disorders, depression, different kinds of anxiety disorders, certain kinds of substance use disorders may be amenable to these treatments. So we're always looking for some other way to get at brain dysfunction besides the wonderful medicines we already have, because the problem is, unfortunately, many people still don't get better with the things that we've got available. There is, I think, we're getting really much closer to having biomarkers to help us be able to identify certain disorders. Again, I'll go back to depressive illness. It looks like it's all the same thing to some people because, symptoms may be similar. But it's clearly not, because if that were the case, I could use one drug and everybody'd get better.
Absolutely.
And it doesn't work that way. So we know there are different subtypes of depression, different kinds of things happening to the brain that we haven't been able to really identify or see. So there are some, really interesting research, things going on right now to help us develop that biomarker that may make it much easier for a doctor like myself to sort of hone in on what might be more effective for you day one versus the process we have now, which is often kind of trial and error. It's not quite that basic, but sometimes people go through multiple different trials of different medicines before they find something that works for them. So I think those things are very exciting. There's all sorts of new things kind of on the horizon. We cautiously look at them optimistically, but even things, for example, like psilocybin, which everybody calls magic mushrooms, right? It looks like it may have a place in the treatment of depression.
Wow.
In the appropriately done.
We've got about 30 seconds. I want to make sure I mention this. Dr. Thistlethwaite is at PsyCare. It's his company, and it's great if you're in private practice or and have private insurance and need care. I don't want to not mention that because he's great. He's, in addition to Health Right, he's at PsyCare in South Charleston. So great practice there. But I can't thank you enough for coming in.
Well, thank you for having me.
I'm sure I'll bring you back again because I could talk to you for hours. And we appreciate you guys joining us. And again, if you need help, please reach out.